Good morning or afternoon. My name is Liana Shvachi. I'm the board member of EIT Health Alumni Community, a community of healthcare innovators. From alumni to alumni is our slogan. I am very pleased to co-host this live interview with my colleague and friend, Christos Tsakaris, from Students Against COVID organization. And now I will give his stage to him.
Thank you very much for the floor, Liana. Greetings, everyone, and welcome to another episode of the Students Against COVID podcast. We hope you are all staying safe and sound amid these troubling and unparalleled times. With the growing burden of coronavirus, we are all slowly recognizing the importance of finding the voices of hope that echo relentlessly, drawing much needed attention to significant and vital contributions that all of us can make. As you might come to know by now, we, Students Against Coronavirus, Students Against COVID, are an international student-led initiative comprising of a global student body from over than 50 countries now. And as promised, we are bringing you today a very special guest with an interesting background and far more impressive achievements. Please welcome with us Asim Masoom, the official Youth Ambassador of Pakistan and a delegate to Youth Assembly of the United Nations. Asim is particularly passionate about sustainable development goals related to the quality of education, healthcare, green ecosystem, peace, and UN for Youth. Currently, Asim is leading a student initiative where pharmacy students manufacture their own hand sanitizers and are able to distribute them in their local community, the city of Bahawalpur, where he is also a research scholar in the university. Asim is a wonderful example of how the youth of the 21st century, people like all of us, has the ability to bring a significant and positive change in the world. So please, without any further ado, let's move on to the questions from some of our audience to have some insight into the topic when, of course, you are ready, Asim.
Yes, I'm ready.
Thank you very much for being with us, Azim. So the first question would be, how did you manage to get students together to organize this initiative?
Well, first of all, I would like to thank the EIT Health alumni, and also I would like to thank the movement of 50 plus young professionals from all over the world that are leading a movement of students against COVID, because we are having unprecedented times at the moment. So in these times, we need such kind of movements led by the youth, especially if we talk about the United Nations or the other leading organizations in the world, so they are also having key importance to give roles to the youth or to the young leadership. So that's a great initiative. First of all, I would like to congrats all of you. And then I will move to explain the detail of my project, as I'm a research scholar in Pakistan and studying pharmaceutical sciences. So actually, it all started back in March when the pandemic was on its spread. It was spreading at a very faster rate. So in the mid-March, the lockdown was announced in Pakistan, and during that, all of the institutions, all of the departments got closed, including schools, universities, and other related departments of the government and private, even in all the private departments or all the shops, everything got closed in March. So after the lockdown, we were thinking what to do. Like, we can't even go to our university, we can't even continue our research project. So we should do some kind of a volunteer project in this time. So we started to get connected with each other via Zoom or via the online social platforms and started to discuss ideas. So it all happened suddenly, but it's connected to another project in February when the pandemic was in China, as China is a neighboring country to Pakistan. I got the opportunity to discuss a project with one of the professor at my university. So he's connected to IEEE chapter. So IEEE is the association of engineers that is working in the IUB, and you might be heard of the IEEE because it's an international organization. So he offered me that we can get funding for the N95 mask project. So I discussed with him, and that time the shortage came. All of the masks suddenly disappeared from all of the market. So we couldn't continue that project. So I got an idea. I discussed it with my friend and my colleague, and I told him that why shouldn't we prepare our own hand sanitizer instead of N95 mask? We can't get N95 mask from the market. Definitely, the government will be going to arrange that very soon. So meanwhile, we can do what's our own professional dimension is. We can formulate something that can be beneficial in this pandemic. So meanwhile, we connected with each other, and then we lay out a plan, and we said, contacted that professor that we need funding from the IEEE organization, and he helped us in getting all the funding, and then we purchased all the material. So it came with a partnership. The project started with a partnership, IUB Science Society partnership with the IEEE, and we got funding from them. And then the phase came for the purchasing of material. When everything is closed, all of the markets are closed, purchasing material is a very difficult task. So most of my colleagues were wondering how we will get this all material from the market. All everything is closed, and we are even quarantined in our home. So I said, okay, we can volunteer here. One or two of students we can gather somewhere, because pharmacies are still open. So we can use some of our resources to connect with some storekeeper, or go down in back in Lahore, so we can purchase material from them, and then we purchase relevant material. It contain bottles, it contain alcohol, it contain glycerine, hydrogen peroxide. We purchase all this material even in the lockdown. So that was all due to the volunteer work. And after that, we had a very difficult situation, because then we had to take permission from the university, and that's a difficult task. But our vice chancellor is a very diligent kind of a person, an amazing person. He gave us the opportunity to work, and he gave us a permission, and we started production for it on 26th of March.
Thank you, Asim. This was indeed, and it is a great initiative, but why sanitizers? Why hand sanitizers? What importance do they bring to your students' community, to your university, and of course to your city and region?
Well, as I told you that every person has its own professional dimension to work. So, so though my interest is global health, and I want to study on global health policy in future, but at the moment, as I'm studying pharmaceutical sciences, so it's related to more to the formulation. So as it was my professional dimension, so I thought it would be much better to work where I can work in an easy way. And if I talk about why I choose these manufacturing these hand sanitizer, well, there was a shortage of sanitizer in Pakistan. There was a great shortage, and the sanitizers suddenly, you have already aware of that. The hoarding starts, and the all the sanitizers, even the tissue papers were not available in the market, in the European market, what I've heard so far. So in Pakistan, all suddenly the hand sanitizers vanishes from the market, and then we were aware of the situation that these sanitizers will be important for the physicians, will be important for the frontline workers, you can say, who will be on the front line, even the pharmacists, all the doctors, nurses. So they will be using these hand sanitizers, and they will need it. So we thought it can be beneficial for them, so we can manufacture, and we will distribute free of cost to them. So from there, IUB Science Society, as a president of IUB Science Society, I took up this lead to have this project with the IEEE, with the help of my colleague, my friends, and we started manufacturing these hand sanitizers.
It sounds like a great initiative and it's working fine, but we know that there is always some challenges in the front line. Can you tell us about some of your challenges?
Well, there are various challenges here in Pakistan. Limited resources in a resource constrained setting, it's one of the most important, you can say, issue or a concern for any country. At the moment, our frontline workers are facing different kind of challenges. The first one I can say is to who gets to live and who does not. Uh, Karachi is one of the biggest city in Pakistan, and if I talk about Karachi, so at the moment the COVID-19 patients are rapidly increasing, and at the moment when the patients are increasing, there are many critical ill patients. Uh, then you have to uh, whether decide who should live and who does not. It doesn't mean that you're going to select one on the basis of some kind of biasness. You have to determine who is the most critical ill one, because you have a shortage of different kind of material. If I talk about the shortage, that include not only includes the PPEs, it also includes the ventilators as well. But now, as our national disaster team is working very fine in the country, so they have managed to bought some ventilators from many countries, and even our own universities are manufacturing ventilators here in Pakistan. Even the Islamic University of Bahawalpur also developed a prototype of a ventilator, and it's sent for the approval. Uh, the next then risk comes for the personal risk. Frontline workers are facing personal risks include all the frontline workers are exposed to the virus when they are working in a pharmacy, when they are working in a hospital care setting, when they are working in the emergency, they are working in the OPDs. They don't know who is coming, if the person is coming, is a corona patient or not. So there are many personal risks out there. Also, personal risk will include, I would say, the shortage of the PPEs for the frontline workers. Currently, we are able to a little bit, you can say, comply with the shortage. But if I talk about the previous month, we had a great shortage of the PPEs which were faced by the frontline workers. So these are all the challenges that are faced by the frontline workers. If I also talk about the mental health, so mental health is a very important aspect, and at that moment when the country is facing the pandemic and now the lockdown is lifted. So I think it's a new concern, and it should be concern for the government as well, that the frontline workers are also now facing mental health issues as well, because as the lockdown is lifted and the coronavirus pandemic is on the rise in country, so the frontline workers are going to be exposed more, so they will be having a mental health issues as well. They might be thinking like if they are working in a pharmacy or they are working in a hospital, or even if I talk about the nurses, so they will be more having mental health issues because they will be more exposed to more of the people. So they might be thinking who is suffering from this disease or not, because many of the patients didn't report their symptoms at all.
Indeed, the situation for the frontline workers is quite difficult. However, before all this started, I'm pretty sure that there were a lot of plans in the academic life of the IUB, your university, and the scientific society you're leading. How were these plans intercepted by the pandemic?
Well, the Islamic University of Bahawalpur was going at a very peak at the moment, was going at a very peak moment when the pandemic came. The university just organized a literary festival in Bahawalpur, and it was, you can say, it was a huge festival. Students and people from all over the country joined that festival, and the university was planning more scientific events, and student activities were going great, and the university was also about to have an exam in April. So many of the projects were halted due to this pandemic. But as I told you that we have a very young vice chancellor here at the Islamic University of Bahawalpur, Professor Dr. Mehboob. He very well controlled all the situation of the pandemic. He took the initiative of the online classes, and he asked the IT setup to develop a system to take online classes in a very quite interesting way, you can say, because it was first time for the country. Many of the people will say the online system was not very great and it has problems in it. The whole of the world was not a virtual study, and the whole of the world was taking physical classes all the year. So it was a new system for everyone, but now the system is developed. The students are getting all the resources, all the materials. The teachers are contacting the students. Even I have seen if the students are having some kind of an issue, like classes on the Zoom, even some of the professors are taking lectures on the WhatsApp voice call. It was a very unique thing for me. It's hectic, but you can say it's the passion in all the teachers through which they are delivering all the lectures. So there were many activities that were halted. Even the IUB Science Society were planning to organize the IUB Science Fair. So it was also halted, and IUB Science Society was also planning to conduct an international scientific conference in which I invited you as well, and promised to come in Pakistan in April, but it was also, we have to postpone that project as well.
Was there any difficulties to get a permission from your university for your initiative and your project?
Well, in such kind of pandemics, no one wants to take risks, even not the administration, not the students, not even your supervisor want to take risks. I'm talking generally here, but when it came to my university, so as I told you, I already made a plan with one of my colleague. I would like to mention him because he was alongside all the moment. So his name is Fazan, and he's also a research scholar here in Pakistan with me. So we made a plan, we made a layout. We contacted our research supervisor, Dr. Asadullah Madni, who is our research supervisor as well. He's a great associate professor. So we contacted him that we want to work on a sanitizer project, and we got the funding, and we are going to manufacture these sanitizers and distribute them free of cost to all the community. So he liked that initiative. So he totally supported us in the initiative, and then we moved the application to the dean of our faculty. And I haven't seen that dean of our faculty has said any kind of like, you can even say, he didn't even linger on the project. He said, that's very well, you want to do a project, that's great. It would be great to distribute and manufacture these kind of sanitizers. So because this was more of a awareness program than to just to manufacture the hand sanitizer, because hand sanitizer were not a trend before this pandemic. Not every student or every other person keeps sanitizer bottle in their bags or take everywhere, because we were using soaps, and the hand washing was preferred before this pandemic. But after this pandemic, we go outside and we can be exposed to anyone. So we need to have this sanitizer in our pocket. So that's why we thought that would be a great project. And then the application was moved from the dean of the university to the vice chancellor, and the vice chancellor totally supported this project. And even after that, first it was a project of the IUB Science Society, and later this project was converted into the national project for the university. The university supported this project, the university supported in funding as well, and we nearly manufactured, you can say, more than there were 5,000 bottles of hand sanitizer, and we distributed free of cost. So I would say, yeah, but yes, difficulties came. We were first upset at the start that we are not going to get permission from the vice chancellor and even from our supervisor. But then things got well, and things got straight and smooth.
That's great, and it was indeed well deserved. We have observed that while manufacturing the sanitizers, you have targeted the different populations group, starting from healthcare workers, moving to police and authorities, and then to the general public. Which groups have you targeted and why?
As I already told you, that the frontline workers are very much exposed to this virus. So when we were manufacturing, we also lay out a plan for the distribution as well. So we decided to distribute these sanitizers among the frontline workers who are working. That include physicians, pharmacists working in the pharmacy sector, nurses working in the hospitals, and then we also thought about the policemen who are there in the lockdown to keep us inbound in the quarantine, keep the population inbound in the quarantine. So the policemen were also exposed to this coronavirus. So we distributed among the police officers, and then even to the army personnel who were supporting these police workers alongside. And we also distributed to the waste management companies, because the waste management companies, employees of their companies came to hospitals and collect their waste, so they can also be exposed to coronavirus. So we distributed to the waste management companies, and then we sent these sanitizers even to different tertiary care and primary care hospitals. Even we sent these sanitizers to hospitals that are not even in Bahawalpur and are in other cities, like we distributed to our peripheries and distributed to our neighboring cities. So Bahawalpur could be much secured, by the boundaries as well.
And last but not the least, how is this activity linked to the notion of sustainable development as described by United Nations Sustainable Development Goals? As this is also very interesting for everyone, especially for our community, EIT Health alumni and the Students Against COVID.
United Nations is working on sustainable development goals. As you know, there are 17 different sustainable development goals, out of which the goal number 3 is related to the health and well-being. Even the sustainable development goal on health and well-being even defined that this goal is related to removing the epidemics and pandemics from all over the world. So it was important to consider that what we are working should be in the domain of the World Health Organization. When we started this project, we first thought we are not working in the industry, and we are not having an industry setup here in our department. We have an industrial lab as well, but not the industrial setup like the industrial companies manufacture these kind of stuff. So complying to the guidelines provided by the WHO, we manufacture these hand sanitizers. So, after if we came in contact with any of the quality control boards, so we can tell them that our hand sanitizers are totally manufactured according to the WHO criteria. And WHO is also part of the United Nations. The United Nations goal is to work on the health well-being of all the individuals in this pandemic. All the individuals, all the frontline workers are exposed. So it was important for the IUB Science Society to work in some such kind, to have some kind of, you can say, a prevention effort to control this pandemic. So if I was to ask, like, how can the students take this initiative in complying with the goals of the United Nations, I can say the United Nations has kept a very straight and simple rule for all the countries, and they have even provided guidelines to the countries to work and achieve the targets by 2030. So now we are having a new target in our hands. It was a sudden, you can say, it's kind of you can say, exam from the nature we are having at the moment. So we have to include it as well in the those epidemics and those pandemics which were United Nations working to eliminate. So you can say it's part of the health and well-being of all the nations.
Thank you so much, Asim. That was indeed a very insightful talk that we had today. I think your team and you truly personify what it means to give back to the community and use your knowledge and skills for the greater good. We are truly living in unprecedented times, and to be able to see the youth taking action and adapting themselves according to the situation is truly a very encouraging sight to see. Projects like Asim's, your project, are also a reminder to all of us to make an individual effort to prevent the spread of the virus, while at the same time look out for one another, cooperate, having the resources to do so. On behalf of Students Against COVID, we would like to thank you once again for sharing your remarkable work for the community. We wish you all the luck. Stay safe.